The COVID-19 outbreak continues to surge on, and the number of deaths is also spiking, but authorities argue the medical capacity is still within a manageable level. But the reality is much more dire as hospital staff, even if they are infected, need to take care of patients. If the situation continues, hospital wards may have to shut down. The medical community and care workers are strongly demanding government measures, saying that every day at work is a battlefield.
Workers at medical and care-providing institutions have taken to the streets, waving pickets and holding a press conference. They voice a desperate appeal saying healthcare capacity, which remains the same level as 2 years ago, has reached a limit, leading to manpower shortage as more workers are also testing positive.
정말로 인력이 이제는 부족하다 정도가 아니라 없는 상황입니다. 곧 병동 폐쇄가 될 수 있을 것 같은 그런 상황이 예측되고 있습니다.
The protesters also mentioned aggravating working conditions at hospitals. Doctors and nurses are asked to come out to work even if they test positive using a self-test kit. And due to shorter quarantine, there have been cases where nurses passed out during their shifts and were sent to the emergency room. This was a situation at a senior care facility as told by on-site officials earlier this month in mid-March when daily infections were registering in the 500 to 600,000 range. At one municipal nursing home in Seoul, 200 out of 300 patients and 90 out of its 130 care workers contracted the virus. A majority of them, with the exception of a few elderly patients, cannot be sent to a hospital. In some cases, even when patients were taken by the ambulance, they had to return because there were no hospitals to accept them.
5명이 케어하던 어르신을 24명을 2명이서 케어한다든가 전원 케어는 말할 것도 없고 정상적인 케어가 불가능한 게 현재 상황입니다.
Health workers also mentioned the grueling conditions, saying they have meals next to garbage piles, having no spare time, and eat leftovers from patient meals.
코로나에 걸렸다고 사직을 해야 했습니다. 어떻게 요양보호사가 밖에서 코로나에 걸릴 수 있느냐라는 것이었습니다.
However, authorities maintain the stance that yes, there is pressure on the medical response system, but the situation is still within manageable levels. But those actually on site dealing with patients say otherwise, calling day-to-day operations nothing less than a battlefield within a war zone. They criticize that the government's quarantine guidelines are moving backwards.